When I have my glasses on, it's about to be a really good episode. Welcome back to the Non-Traditional Veterinarian. I'm Dr. Bamonte, and I want to talk about a topic that I find myself talking about a lot face to face and in nutrition consults when pet owners come to me and they're like, my dog is on omeprazole, an antacid, and we talk about fat, we talk about protein, and we talk about things that have been very explored well on the traditional conventional side. And that is what these pet parents are coming to me with, that information. And also, I want to bring another perspective. I'm not going to say a better perspective, but another perspective. And what I tell my clients all the time is I like, me personally, and for my clients, to have tools in our toolbox. For example, let's bring out this mug. So depending on what I was working on, let's consider this a toolbox. I may need a dry erase marker, scissors that are for a cricket, regular scissors. Maybe I want a pink pen. Maybe I need a pencil. Maybe I need a felt tip pen. Maybe I want a purple highlighter marker. It really just depends on what I'm using. This is a symbolism from a course that I was in for many, many years where it was like stirring the pot. So depending on what I'm working on depends on what I need. I may not need all of these at the same time. Heck, it may be weeks that I may not use the pink pen. But let's say I want to decorate something for Valentine's Day, you better believe what got used. And so that's how I look at all this. This is tools in the toolbox. This is to give hope when you've tried all of the things and nothing is working, or you don't feel aligned with it because you're like, okay, it's working, but it feels like a band-aid. And so today's topic, I want to talk about what we have to consider when your pet is on a medication like omeprazole for a long time, because there are things to consider. And you know me, I like to talk about root cause. I like to think about the cause and effect. And sometimes we need to do these things in the moment, right? We're a trial. In fact, just a few weeks ago, one of my nutrition clients, her dog was having a little bit of regurgitation, and we were trying to figure out, is this a anatomical issue? Like, do we need to raise the bowl? Is this now something with the diet? Like, what is it? So I actually had her do, she brought up omeprazole. I was like, you know what? Let's try it for like 2 days. Let's just see. Use it as data so that we can make decisions. So sometimes things are used to make decisions. Sometimes in the interim, until we can get to the root cause and support this pet, we lean on the traditional and conventional options. Also, now that I know more, I want to explain more on, here's also what to consider. Because I have some pets that come to me that have been on omeprazole for years. And I'm like, yeah, we need to test their gut. And this is the episode that I'm going to tell you why. So, omeprazole can absolutely be a place to be used in pet care and veterinary medicine. It can suppress stomach acid really well for some pets. It can be helpful with acid related problems. There's other antacids that we can do, other proton pump inhibitors, absolutely. And so it often can provide support for kinds of cases where there's ulcers, erosive lesions, acid reflux, but it should not be a reflex to go and reach for it every time a pet vomits. And if we're noticing when this pet comes off of this, we have this issue, why? Let's dig deeper. Let's look at the gut, and not like, we know it's a gut issue, right? Because we're putting them on this antacid medication, this medication to suppress acid. But I'm like, can we take it a step further or 3 steps further? Why is this going on? How does this pet need more support? And so the issue is when this gets used casually too long, or casually consistently inconsistent. And so stomach acid is not bad. I want to start with that. It's not bad. It's part of the normal digestion process. It's one of the body's first protective barriers. It's how it breaks down food. And when you suppress acid for too long, you can change the whole ecosystem, the whole environment of that pet's gastrointestinal tract. And what happens from this is this can alter the survivability, the rigor to the gut microbiomes in their GI tract, where they survive and how the rest of the gut ecosystem behaves because of this. So in human and veterinary literature, proton pump inhibitors like omeprazole have been linked with dysbiosis, shifts in the microbiome. So even a 7 to 10 day or 15-day course can change the stomach and the small intestine microbiome. In fact, I have information here that is very reputable that I went through my own deep dive on the gut microbiome for my patients, well beyond what I had been exposed to and learned. It was like a 6 month intensive. When I say intensive, intensive in the right way, a collaborative environment, but very, maybe the right word is more laser focused, very intentional. And omeprazole can cause dysbiosis. The good news is that sometimes this can be reversed depending on how long they've been on, and if we take them off for like 7 to 10 days. And so it matters because the microbiome is so responsible for immune signaling, for colony resistance for certain bacteria or antibiotics, fermentation, gut barrier function, inflammation. It has this community is so important. And there are times that things are going to happen where it gets a little insulted. But our job should be to nurture it and protect it. And when it does get insulted, how do we nurture it back? And so when we have this reduced microbiome diversity, we have fewer good bacteria like the core, then we can have issues in the lower GI tract. We can have a higher risk for GI infections. Remember, that stomach acid is there for a reason. And so there is potential adverse effects if we're using it long term. So in dogs specifically, I want to highlight this, and I know cats will sometimes be on proton pump inhibitors. I hear of dogs a lot more. Specifically, long-term use of omeprazole has been associated with raising their gastrin levels. And so, in fact, in 2024, there was a randomized trial with healthy dogs, and they measured their serum gastrin levels like 30 to 60 days after the use. And it matters because when that acid is decreased, it is suppressed, the body responds, or the body can respond, again, because remember, no two pets are the same, can respond by pushing harder to produce more acid later. And it's like, well, if you're wanting to reduce the acid, now the body is going to try and compensate and produce more later. And sometimes we can have a rebound acid hypersecretion. And if that's the problem, we don't want that, right? And so it's a concern when pets stay on it for weeks and then stop abruptly. So sometimes we need to taper. And so you may be like, I've never done this in my dog. Should I be doing this in my dog? Why do people use this medication then? And so it's commonly prescribed, it's easily accessible, it's over the counter, and it sounds protective. And it feels like a safe just in case. I I had done it before. And it's often added when a pet is maybe nauseous or vomiting, taking NSAIDs, has a stomach ulcer, maybe there was a mix up and they were on NSAIDs and steroids at the same time. Maybe we're switching NSAIDs. We think there's regurgitation. I have seen pets on it for various reasons, or a complicated illness or a medication that they're on. However, there is a possible risk down the road when we are doing this. And I'm all about informed consent. If you listen to this and you're like, I know my risk, I'm going to take it. I don't have to deal with X, Y, and Z with my pet. Great. You deserve to be educated and having this discussion. And so omeprazole is not a villain. It's not at all. However, it's also not harmless background noise either, especially when it's long term. It is very powerful and it can be useful when it is done very intentionally and very delicately, and there's a true acid related problem. And again, this is where I'm going to chime in. Okay, can we get to the root of that problem so they're not on this medication, which is going to further their problem? Because it can change the gut microbiome. It can shift the gut microbiome ecosystem. It can increase gastrin and potentially even raise infection risk because now that first line of defense with that stomach acid is not there. So if we're going to use it, be intentional and not be automatic. And so one of the very interesting things about omeprazole that I find so interesting and how this cascade, this domino effect, this snowflake to snowball to avalanche can happen is omeprazole can have an impact on the gut long term, which I have highlighted. especially specific bacteria, especially a specific bacteria, Peptoclostridium hiranonis. This is a very special bacteria that we want to nurture and talk to and tell it it's pretty and it's strong and it's important, because this helps pets, dogs, convert primary bile acids into secondary bile acids. And this is important because secondary bile acids are part of your dog's natural defense system. They help regulate inflammation. They support the gut integrity. They help keep harmful bacteria in check, like Clostridium difficile. We don't want that one out of whack. And so when you use a medication like a proton pump inhibitor, like metronidazole, it can increase the dysbiosis index, which is what we don't want. This is where a high number is not something to brag about. And it can decrease this Peptoclostridium hiranosis. And that can lead to chronic inflammation, chronic enteropathies, or blindly diagnosed IBDs. So animals with high DI, which is a dysbiosis index, again, remember, we don't want a high number with this, often have a short-lived response to fecal microbiome therapy, restorative fecal microbiome therapy, aka fecal transplant, which will require them to have multiple rounds of it. Persistently high dysbiosis index with a low Peptoclostridium hiranosis in dogs with clinical signs that are refractory to a multimodal therapy, meaning you're trying all these different things, often indicate that their bile acid has malabsorption. We don't want that. And then we have someone come in like streptococcus, which can increase often as a response to this maldigestion, malabsorption. So there is all these downstream effects that can happen. And so when you use a medication like omeprazole long term, yes, you're lowering the stomach acid. You're also changing the environment in their GI tract. What survives, what thrives, what multiplies, what gets suppressed, and what is allowed to overtake. And what we can sometimes see in these dogs on these acid suppressants is they can have these reduced levels of this bacteria. So then we have this downstream effect of the Peptoclostridium hiranosis being under ideal. And so that means less conversion of the bile acids, which means fewer protective secondary bile acids, ultimately a gut that's very vulnerable, dysbiosis, opportunistic bacteria, whether good or bad. And in fact, when these bile acids are not converted appropriately, some of these bile acids get to the colon, and the colon is like, whoa, hold up. You're not supposed to be here. Imagine you're sitting in your living room watching TV. It's the end of your day. You're relaxing. Your feet up on your couch. You have a nice plush blanket. Maybe your dog or your cat is right next to you. Dim lights. Air is down low. And all of a sudden, somebody barges into your home. Would you not jump up and be like, excuse me, who are you and why are you here? You'd be like, you'd be throwing your hands up and be like, get out, leave. Maybe you're calling the cops. Maybe you're calling your husband. Maybe your husband's calling you for backup. I don't know. Different dynamics for different people. But either way, you would make it known. And that's what happens when these bile acids get to the colon where they're not supposed to be unconverted. The colon is like, hold up, what are you doing here? And then we get the colitis, we get the abnormal stools, we get the gas, we get the mucus on the poop, maybe we get blood in the poop. Because the colon's like, I'm not happy. And if I'm not happy, nobody's happy. And that's what happens. And so again, these are all downstream effects. If you're cool with all this, great, but you deserve to know. And so a simple way to protect your pet is that omeprazole, again, is not a villain, but I want you to know it doesn't just turn down stomach acid. It can quietly shift the microbiome. And that can have a huge role in the future. And commonly pet owners will come to me and be like, nothing has changed. They've been on this medication for years. They've been eating this food for years. I don't know what's different. And I'm like, okay, let's look at the patterns here. And that's often, I feel like when pet parents come to me, that's what they've said. They've been eating this food. In fact, just yesterday I had a pet client. She looked like she was a deer caught in the headlights. And she's like, but he's been on this food forever. And I'm like, exactly. It's highly processed and it's not doing him any service right now. He's overweight. He's got skin issues. He's got behavior issues. It's possible this has just been the straw that broke this camel's back. And so this is where we zoom out, literally, like take your phone, do the zoom out. And it's not just a does this stop the symptom, the sign that you're seeing. It should be what is this doing to the ecosystem long term? Because the gut is not just this tube that connects, you know, your in to your out or theirs. It's an ecosystem. And that ecosystem, if, hopefully you've listened to several episodes, especially the last few, where I went over functional tests, why I did them on my dog, the meaning behind them, what it means if they're abnormal or normal. Your pet's microbiome, the community in their gastrointestinal tract of bacteria and fungi, because there are fungi in there, very, very select. They're important. They're not just making poop. They're not just breaking down food. They're dealing with the immune system. They're helping regulate inflammation. They're influencing your pet's weight. Ooh, that is a really big topic that we need to talk about in another podcast coming up. We need to talk about that because dogs who have a dysbiotic gut, an imbalanced gut that is not harmonious, can have weight issues, whether struggling to gain weight or to lose weight. And so when we start, you know, doing witchcraft, and I'm not saying that these medicines are witchcraft, but when we start kind of doing these things and blindly just refilling, blindly just re-administering, these are things to be considered. Again, and if you're okay with that, you have informed consent, you know about it. Or maybe you're like, wow, I understand that. Yes, my dog does better with this, and I don't want to have to deal with a bigger issue down the road. These are things that we do accomplish in a one-on-one nutrition consultation. These are things that we do accomplish in a one-on-one in-home visit. I am just realized my head is cut off. Woo! We were up close and personal. These are things that we talk about. And it's not just, well, if they're on it, you better get them off. If you care, you're going to get them off. That's not it at all. It's okay, what can we do? Do we need to analyze the gut? Do we need to change the food? Is the food good? What do we need? Are there other things underlying here too? Are there toxins? So looking at the panoramic picture so we can support your pet as good as possible. I can't wait to see you on next week's episode.